Clinical Mental Health Profession, Capstone Paper. Jamie Freeman. Psych 4010, Psychology Capstone. Clinical Mental Health Profession. The professional role I chose as a focus for this paper is a clinical psychologist. The reasons I've had for choosing to explore on the clinical psychologist profession is that it is my primary career option. Aside from that, it is involved in helping people through providing assessment, diagnosis, and treatment plans. The following are some of the knowledge needed to succeed in this profession: a master's degree or philosophical doctorate degree in psychology. The needed skills that can contribute to the success of a clinical psychology professional are observation, interviewing, problem solving, critical thinking, work with other professionals, and social or cultural awareness. While characteristics needed to be successful in this field include being client-oriented, empathic, non-judgmental, and confident. Van der Heijden, 2002, discussed 3 variables that can predict the success of a person in his or her line of work. The 3 predictors are participating in social networks, participation in training and development programs, and taking actions that would enhance skills that are important for career growth. In terms of developing a social network, a clinical psychologist can collaborate with and learn from other professionals like a medical doctor. While in terms of training and development participation, a clinical psychologist can participate in training and seminars to keep his or her knowledge related to therapy updated. Aside from that, a clinical psychologist should be able to complete a clinical practicum. Actions that can be taken by a clinical psychologist in order to grow in his or her career would include pursuing higher educational programs. Obtaining and maintaining a license in clinical psychology is also important. Here are 2 of the main theories used by clinical psychologists. First theory is the cognitive behavioral theory, which states that an individual's emotion, behavior, and responses are affected by his or her cognitive process. Gonzalez, Prendes and Resco, 2012. The second theory is the systems or family theory, which emphasizes on developing an understanding of the influence of the systems that an individual is a part of towards his or her emotions, thoughts, and behavior. Corsini and Wedding, 2011. The following are the main research areas that clinical psychologists focus on: improving the process of assessment and diagnosing mental and behavioral disorders, improving the current therapies that are used to treat clients with mental and behavioral disorders. Although there are various ways that researchers can conduct their studies, here are some of the methods that clinical psychologists use in their research. Experimental research methods. Case studies. Correlational studies. A clinical psychologist takes various steps to help in expediting positive social change. I mentioned in my paper that clinical psychologists can provide pro bono services to victims of traumatic experiences, especially children and teenagers. Another way is through providing pro bono clinical services for agencies that cater to people with mental and behavioral problems.